disc injection approach, what we'll be doing in combination with Dr. Antoine at Select Health, is very elegant. It's very careful. Traditionally, disc injections have been completed in a very prescribed way. Needle is being placed into the center of the disc, which is the gel-like portion called the nucleus pulposus. And that is where cortisone injections have been placed previously to try to decrease pain in a disc. I'm very thankful to the individuals who have created these, elaborate and difficult procedures previously to me, as a foundation for me to now use more elaborate procedures. Understanding how a disc degenerates or why it does is putting into our perspective the idea of a line of dominoes, and understanding that the disc is one of those dominoes. It's not the first one typically. There are ligaments, fascia, there's blood supply, there are joints, capsules that hold and stabilize everything around a disc, as well as neuromuscular patterning and postures and alignment. And all of these pieces combine to create dysfunction and degeneration at a disc. What's been developed at OrthoCure Clinic is to work on each of those structures that support the disc. If you look at an anatomy manual, and we'll include some of these on the website, behind the disc is what's called the posterior longitudinal ligament. That ligament can be injected safely if done carefully with knowledge of anatomy and the appropriate guidance. 9 times out of 10, when I'm injecting a posterior longitudinal ligament, it reproduces the pain that the patient has in that location. It's a very important structure. And if you've heard of a disc herniation or a disc bulge, that disc is bulging backwards. It's hitting the posterior longitudinal ligament. The posterior longitudinal ligament tries to hold that disc in place, essentially. That's its job. But over time becomes weaker, looser, and more incompetent, and that disc bulges worse and worse over time. Another structure that we work on is not just inside the gel center part of the disc, but also the back of the disc. The back of the disc is called the posterior annulus, and it can have varying degrees of tears and internal degeneration that causes direct pain, but also allows some of that gel material from the center to leak out and irritate tissues, including nerves. After that, I will also place regenerative agents directly into the nucleus pulposus. It's kind of a nice reserve place to put some of the cells, so that when as gel material is extruded abnormally, it can kind of plug the holes. Where appropriate and where safe, I can also place a needle into the anterior longitudinal ligament, which is in the front of the disc. Those are very careful and very uncommon, if not unique, injections that are performed at OrthoCure Clinic. In addition to that, as part of the disc degeneration process, the disc is fed by blood vessels that come from the bones above and below the disc. These blood vessels meet in what's called an end plate and feed the disc its nutrients, because the disc has very, very limited blood flow. Degeneration in that end plate are known as mobic changes, and those are advancing types of degeneration that occur as part of a process of disc degeneration. We've developed procedures at OrthoCure Clinic to place needles directly into those end plates, to place regenerative agents to restore the bony nutrients that are being delivered through those bony surfaces through the bone to the disc. That is the basic set of injections that I do, which are not basic at all actually, for a disc, but then also all of the ligaments that support the disc in the posterior aspect, which has been discussed elsewhere, the supraspinous, interspinous, and ligamentum flavum ligaments, as well as the intercapsular ligaments and the joints themselves. This sounds like a lot to do, but the development of these procedures have happened a small baby step at a time, adding things as time has gone on, and it's created essentially a program that treats where the degeneration but all of the things around it that allowed that degeneration to occur. And treating these things in combination at the same time is the best way to lead to the best outcomes and the longest term outcomes.